You may ask, what is the CFSR? The CFSR provides an umbrella for the work we do in child welfare. The Child and Family Services Reviews, or CFSRs, are a partnership between the federal and state governments that seeks to examine state programs from two perspectives: outcomes of services provided and systemic factors that affect those outcomes. The review process identifies the state agency's strengths as well as areas needing improvement, and then uses a program improvement plan, or a PIP, to help states make needed improvements and build on identified strengths. Central to the review process is the promotion of sound practice principles that support improved outcome for both children and families. The ultimate goal of the review process is to drive program improvements by focusing on systemic changes, as well as to enhance states' capacity to become self-evaluating. The primary focus of the CFSR reviews is on outcomes for children and families and the child welfare system's efforts to support the achievement of those outcomes. Remember that when we talk about the child welfare system, we are talking about the state child welfare agency, as well as all of the other agencies that work together to help families achieve positive outcomes. In other words, we are looking at the entire system of care, a system that includes state agencies, service providers, the courts, law enforcement, foster and adoptive parents, and so on. Because of the structure and autonomy of the education system, it is the only system that is considered separately from the child welfare system in this review. To ground you in this knowledge, it is important to understand the history of the CFSR process. Federal legislation established the authority for Child and Family Services Reviews, or the CFSR process. In 1994, Congress passed amendments to the Social Security Act, authorizing the U.S. Department of Health and Human Services, through the Children's Bureau, to review state child and family service programs to ensure state conformity with Titles 4B and 4E. Many of you are likely familiar with ASFA, the Adoption and Safe Families Act of 1997. This act influenced the design of the reviews by establishing and emphasizing the child welfare goals of safety, permanency, and child and family well-being. The Child and Family Services Reviews are conducted by the Children's Bureau within the United States Department of Health and Human Services. The first round of reviews took place between 2000 and 2004. The second round between 2007 and 2010, and the third round of CFSRs between 2015 and 2018. The Children's Bureau conducts the reviews to ensure conformity with the federal child welfare requirements, determine what is actually happening to children and families in child welfare services, and assist states in helping children and families achieve positive outcomes. The reviews are structured to help states identify strengths and areas needing improvement with their agencies and programs. Ultimately, the goal of the reviews is to help states improve child welfare services and the outcomes for families and children who receive those services. Specifically, the CFSRs measure 7 outcomes and 7 systemic factors. The outcomes measured include safety, permanency, and well-being, each of these being defined more clearly in your handout labeled CFSR Outcome and Systemic Factors 2018. Safety is defined as children are first and foremost protected from abuse and neglect, and children are safely maintained in their homes whenever possible and appropriate. Permanency is defined as children have permanency and stability in their living situations, and the continuity of family relationships and connections is preserved for children. Family and child well-being is defined as families have enhanced capacity to provide for their children's needs, children receive appropriate services to meet their educational needs, and lastly, children receive adequate services to meet their physical and mental health needs. The systemic factors assessed through statewide assessment and stakeholder interviews measured by the CFSR include the effectiveness of the state system for child welfare information, case review and quality assurance, training of child welfare staff, parents, and other stakeholders, the services that support children and families, the agency's responsiveness to the community, and foster and adoptive parent licensing, recruitment, and retention. As I indicated, the handout labeled CFSR Outcome and Systemic Factors 2018 is available with this information and can be shared with staff, colleagues, or others who need a big picture or cursory understanding of the CFSR. You may want to consider sharing this with child welfare staff during a unit meeting. The CFSR outcomes and systemic factors are measured by reviewing specific data. The information in your handout, labeled CFSR 2018 Outcome and Systemic Factors with Measures, ties the outcomes for children and families to the data that measures these outcomes. Here we will take a look at the variety of outcomes and measures in each area. Note this is also in the handout referenced. As we review the CFSR outcomes and measures in each area, take note of how they align with the section on successful outcomes for children and families earlier. First, we have safety. This is how we measure how children are protected from abuse and neglect. There are two primary outcomes, and under each of these are subcategories as well. Permanency has two main categories and multiple subcategories that are important when considering achievement of permanence for children. You may note some key elements of data that are reviewed include reentry rates, permanency goals and outcomes, placements with siblings, among other measurements. Lastly, we have well-being, and there are three main categories considered, with multiple subcategories that are essential in measuring outcomes related to the well-being of children and families. Things such as worker visits with the parent and the educational needs and mental health of the child are among some of the measures looked at. It is important to know that significant financial penalties may be assessed for failure to make the improvements needed to achieve substantial conformity. Based on assessment results, states develop a Program Improvement Plan, or PIP, to address areas needing improvement. Each state's Program Improvement Plan must include measurable goals for improvement, action steps, and an implementation timeline for addressing each outcome that did not meet the requirements for the 7 federal child welfare outcomes and 7 systemic factors under review in the CFSR process. It is important to note that the federal benchmarks for the case review and systemic factors are aspirational goals. No state meets all of the federal performance benchmarks. When reviewing the entire report, you will see that items rated as needing improvement in the CFSR report often include some strengths as well. Jerry Milner indicates that the CFSR was not envisioned to be a pass-fail review, but rather a review to help states understand their strengths and weaknesses and to guide continuous quality improvement activities. So you may be curious to know how Wisconsin did in the most recent CFSR. I will review this information now. You can also reference this information in the handout labeled CFSR Report. Overall, Wisconsin performed at or above the national average on 4 of the 7 outcome measures for safety, permanence, and well-being, but did not meet the federal benchmarks. In addition, Wisconsin met the federal performance standard for agency responsiveness to the community, but not the other systemic factors. Here are some of the 2018 Wisconsin CFSR report findings. In the 2018 CFSR, Wisconsin was found to have the following strengths: regular and effective collaboration between child welfare system and stakeholders, strong active youth advisory council, timely initiation of investigations, keeping siblings together whenever possible in out-of-home placements, assessing and meeting educational needs of children in out-of-home care, consistent application of licensing standards, and timely completion of background checks for foster parents and other out-of-home care providers. The 2018 report listed these areas for Wisconsin to focus improvements: assessing and addressing safety through the life of a case, effective engagement of families, especially fathers, quality of caseworker visits with children, timely completion of child welfare worker and foster parent training, timeliness of court processes for permanency, especially termination of parental rights, availability of key services, especially mental health and substance use disorder services, need for additional foster homes and out-of-home placement options for children with complex needs. Please refer to your handout labeled CFSR Performance Outcomes Detailed. We won't review this handout in the training, but we wanted to provide a more detailed review of the CFSR and how outcome performance is assessed. This handout outlines the various outcomes under safety, permanency, and well-being, with details about how each of the items is assessed in the CFSR process. This handout also contains a lot of detail that most people outside of child welfare are not interested in, but provides important information about how each of the items are assessed for those who are interested or need this level of detailed information.